A 45-year-old female presented to her office with a 9-week history of productive cough of white phlegm. Her cough is worse at night and in the morning, but it gets better during the day. She doesn't have any fever, shortness of breath, chest pain, night sweat, or weight loss. She had already seen multiple physicians for it at urgent care and 2 specialists, lung and throat. She also took 2 courses of antibiotics without any significant benefit. She has high blood pressure, high cholesterol, asthma, and she's overweight. She eats out with her boyfriend nearly every night, and she drinks 1 glass of wine with her dinner. Her physical exam, vital signs, chest x-ray are normal. Guess what this lady has? Till next time, stay well.